Well, we had another challenging budget this year, primarily because our healthcare costs are really out of control. If you look at over the last few years, the one area that keeps going up incredibly fast, and it's our cost for healthcare. We were over budget right now about $650,000. So what we did is we asked them to come up with an additional $1.3 million. And they did that this year, which was really helpful to the employees, and I'm just not sure all the employees understand. That's like having a 1.5% raise. And we could have given you a 1.5% raise, but you would have used it all in the health fund or to pay for your insurance had they not made that decision for us. The health fund and the cost for our health insurance is eating up so much of our budget that it's really going to be difficult for us to ever get the comp study plan approved so that we start paying the employees what we think that they deserve in terms of the hard work they're doing. And it's because the council looks at health benefits and compensation all in one basket. So any money that we have to spend on health insurance is really taking money away from future raises.
I first got involved in health insurance in 1999, and we had a little over a $3 million cost on an annual basis citywide, all employees and dependents. And it's over $12 million now, and it just grew by $1.3 million in 1 year. And that can't continue. That is not sustainable. And so we have to change the way we behave. We have to change the way we take care of ourselves. If we don't, it's going to come out of our pockets. Like I said earlier, I mean, there's no other place to do it. We can take it out of our pockets, or we can scale back the plans. Either way, it costs us more money. The people that are really most impacted are our frontline employees, the ones that make the least money. Because we may see a 5 or 6% increase in health insurance. We may see an increase in what an employee has to pay to keep their dependents covered. But for a frontline employee, that could be anywhere from half of the raise they got to all of it to more than the raise they got. And we just can't continue to do that. Health insurance is too important to our employees and their families. We're a family organization. We're a family-friendly organization. We've got to make a change.
The Human Resources Department is going to begin working on a strategic plan to really be able to see what we can do to figure out the model for wellness and how to better handle it. We're going to be asked to do things to help each other out, to help out with our costs. And I think the strategic plan will really help identify where do we think healthcare could end up and what can we do to help make that better or not hurt so much. This fiscal year we began to implement for the first time is the Naturally Slim program that appeared to be very successful. We had about 100 employees that were in that. So we're going to be continuing the Naturally Slim program. And also Lindsay has been doing a lot of great healthy and physical fit type activities, and she's going to continue to provide more of those things.
We have a plan that is called the WOW plan that pretty much the deductibles and the benefits of that plan are the same as what we currently have. And then we have a lower plan which has higher deductibles and some additional costs to it that is just not as favorable for the employee or their beneficiaries or their dependents. To qualify for the WOW plan, all you have to do is get the screening done, attend an open enrollment meeting. If you are a tobacco user, you have to go through a cessation policy. Program. You don't have to quit, but you do have to go through a program, and we encourage everybody to quit.
Well, what's going to happen this year is as soon as we do the finger prick test. We will have a registered nurse or medical professional will be there to be able to meet one-on-one with us to interpret our results. And our main goal is education. So we want to make sure that we can educate our employees on what did the results mean, what are they saying, is that good, is that something we need to work on. So that's something that's really important to us. For this year, which is going to be for fiscal year 16, just us as the employee needs to do this. However, starting for fiscal year 17, what will happen is that any spouse on the plan will have to do the same things where we are now, which is to go ahead and have a wellness screening, to go to the open enrollment and have the finger prick, and also sign the tobacco affidavit. The bottom line that I really see is I see the city trying to figure out how to better get a handle on the escalating prices, and I see the responsibility for that coming back to all of us as employees, and for us to have the accountability of what are we as individuals doing to help the plan out, and that's really where I see us.